Welcome, and thank you all for being here today. My name is Jodie McGough. I work as the Nutrition Manager at the Healthy Eating Advisory Service. So before we begin, I would like to acknowledge the traditional lands on which we all meet today. So for myself, that is the traditional lands of the Wurundjeri people of the Kulin Nation. However, I'd also like to acknowledge the many lands on which we are, all of us here are attending today. I'd like to pay my respects to the traditional owners of the country, whose deep connection to land, water, and community has nurtured children and families for tens of thousands of years. We acknowledge their elders, past and present, and extend respect to all Aboriginal and Torres Strait Islander peoples with us today. We recognise that creating safe, inclusive environments where every child can thrive, regardless of their dietary needs or cultural background, reflects the same spirit of community, care, and responsibility that has always been central to Indigenous cultures across Australia. So just some housekeeping before we get into the formal part of the presentation. For the purpose of today, all microphones and cameras have been turned off for attendees. This presentation is being recorded and will be sent in a follow-up email at the conclusion of this event. The comment section has been turned off. However, the Q&A is enabled for today's event. So you can ask questions through the Q&A function. You can ask these questions throughout, and you can also ask the questions towards the end of the event. So we know that nutritious meals are important to help children grow, learn, and thrive. When planning menus for children with food allergies, intolerances, and other special dietary needs, it's important that these children receive nutritious alternatives. Today, we'll be showcasing a new online training course and supporting resources. These have been developed to help you, the early childhood sector, to confidently plan your menus and adapt recipes to cater for children with food allergies and other special dietary requirements. The ideas and suggestions provided ensures children with special dietary needs continue to receive the nutrition they need and also to meet government guidelines when planning menus. You will be hearing from Ricky Gelman, Dietitian and Nutrition Policy Advisor at the Healthy Eating Advisory Service, Ingrid Roche, Paediatric Dietitian and Senior Project Officer at the National Allergy Council, Vaishali Patel, Centre Chef, Bloom Early Learning, who will share her learnings and insights from completing the course. We are also joined by Dr. Meryn Netting, Paediatric Dietitian and Senior Project Officer at the National Allergy Council, who will assist during the Q&A at the end. So the Healthy Eating Advisory Service is funded by the Victorian Department of Health and provides free public health nutrition support to early childhood services. We provide free, practical advice about providing healthy foods and drinks and promoting healthy choices in early childhood services. Available on the PEACE website, you'll find a range of resources to help with your menu planning, including guidelines, food and drink ideas, online training, and an online menu tool, Food Checker. More than 850,000 children attend long daycare across Australia. In these settings, children can receive up to 70% of their daily nutrition while in care. That means the food and drinks they are offered are important for their health, growth, and development. In 2023, the Healthy Eating Advisory Service spoke with cooks, educators, and centre managers. We wanted to understand how to support you with your menu planning process. We heard from you that managing food allergies and dietary requirements is one of the biggest challenges. We heard that staff are managing a wide range of dietary needs. This includes food allergies and intolerances, vegetarian and vegan diets, and also includes other cultural practices such as halal and kosher. We also heard that the number and diversity of these food allergies and special dietary requirements is increasing. Services are now catering for more dietary requirements and preferences than ever before, leading to increased challenges with menu planning. We know that some centres are creating separate allergy-friendly menus, which can create extra work for staff and sometimes set children apart. Services told us they want simpler menu planning that caters for all children. So in response, we have developed in partnership with the National Allergy Council a new online training course and supporting resources to go with it. The course provides practical, evidence-based strategies for managing allergies and other dietary needs. The new training course and updated resources will help to ensure that menus remain nutritious and safe for all children. But before we get into showcasing the course, I would now like to hand over to Ingrid Roche from the National Allergy Council.
Thank you, Jodie. So I'm just going to run through a few things that we know about food allergy in children's education and care. But firstly, just to talk a little bit about the National Allergy Council. So the National Allergy Council is a not-for-profit organisation that's funded by the federal government to implement the National Allergy Strategy. So we run a range of projects to do with allergies, not just food allergy, but drug allergy and other allergies prevention programs and whatnot. But for this particular project, we have combined our schools and childcare program, which is called Allergy Aware, and our food service program, which is called Food Allergy Aware. And Merrin leads the childcare and schools program, and I lead the food service program. So we've joined together with National Nutrition Foundation and Healthy Eating Australia to provide these new modules for children's education and care. So we know that food allergies in Australia are a big problem. So 1 in 10 babies and 1 in 20 older children have food allergies. So that's a lot of food allergies that you guys will be seeing in your sector. So across all of children's education and care. So this includes long day care and after school care and other childcare services. About 1.3 million children in Australia are cared for by these services. And in early children's education and care, between 50 and 85,000 children will be attending at some stage. So educators, cooks and chefs and directors really have a big job to keep these children safe. We know the incidents are happening and it's mainly from children actually being given the food that they're allergic to whilst they're in the care of a childcare service. So this is why we're so passionate about providing training and support for everyone working in this sector. Most incidents that happen in childcare happen to children who are allergic to cow's milk, egg and wheat. But just a reminder that children can be allergic to any food and that we have to take all allergies seriously. So even if a child doesn't have an anaphylaxis plan, it doesn't mean that they will never have anaphylaxis. So we don't really want in the way that we manage food allergies to differentiate between children who have had anaphylaxis in the past and children who have mild to moderate reactions. We really want to be as strict with all of our food allergies so that we're keeping all the children safe and so that you have the same processes for all your allergies and other serious intolerances. So the other thing that we have been advocating for in this space, so our programs have been around for sort of, depending on the program, between like 5 and 8 years. So in the childcare space, we really advocate for a food allergy aware approach because that way, rather than banning a particular allergen in the service, you're able to have strategies in place where you'll use the same strategy for children with food allergies, no matter what allergy they have. So if you ban nuts, say, that can sometimes make both parents and staff a little bit complacent about food allergies or forget that other food allergies can be just as serious as as nut allergies. So we want to make sure that we have strategies in place to manage all food allergies. So whether you're allergic to milk or wheat or nuts or banana or strawberries or tomato or anything. So remember that children can be allergic to anything. So we released our All About Allergens training for children's education and care in 2019. So we have a range of courses that sort of all align with best practice food allergen management. So we've got different training for different food service sectors. So you can do an All About Allergens course, whether you work in restaurants, cafes, whether you're a cook or chef, if you work in childcare or schools or camps or hospitals. So, of course, each sector has slightly different problems and different ways of dealing with things, and food services are slightly different in all of those contexts. So that's why we have a course for a specific food service sector. So these courses, so this particular course for children's education and care, and many of you may have done this already because we have actually had over 63,000 staff who work in children's education and care complete this course, which is fantastic, and we're very happy with that. But obviously we want all staff to be doing this. So this course covers all about food allergens. It covers best practice procedures to make sure that the right food gets to the right child, and how to manage food allergens when you're planning a menu, when you're buying food, choosing ingredients, when you're storing food, and when you're preparing and serving food and drinks for children with food allergies. So how to manage cross-contamination and how to make sure that that child's allergen isn't actually in the food that you're serving. So we very much advocate that food allergy is a shared responsibility. So everyone in the service needs to be aware of food allergies and communicating about them. So the parents need to tell us what their child's allergic to, and if that changes at any point. The service managers and directors need to have systems in place for collecting that information and transferring it to the cooks and chefs and the educators who are looking after those children. And then we also need to make sure that the service has a training policy where everyone who is involved in preparing or serving food actually has access to food allergen management training, so that everyone is on the same page and everyone has food allergies on their radar in terms of a child safety issue. So the course, we recommend that, as I said, anyone who is involved in making food or serving food and drinks to children in children's education and care have done some kind of food allergy training. So our course is free, it's online, you can go in and out of it and stop and start with whatever sort of time restrictions you have. There's a quiz at the end, so you get a certificate. But it runs through all of those aspects that I talked about. And so for anyone who is serving, supervising, or anyone who might be asked about ingredients or allergens in the food that's served in the centre. So in terms of legal responsibility, if a parent asks the centre what ingredients or allergens are in the foods that are served, you actually have to be able to tell them. So having all of your records in place and that information available for staff just makes it much easier for staff to be able to provide that accurate information to parents so that they can feel more confident that the service is able to take care of their child with food allergy. Along with our course, we have a resource hub. So the resource hub is designed to have downloadable resources that you can use in your centre to implement the best practice food allergen management strategies that we talk about in the All About Allergens course. So there's a food allergy policy that you can download as a Word document and modify to make it suitable for your specific centre and scenario. There's a food allergy audit tool, so you can go right through your admission processes and your enrolment processes and right through your kitchen and see what you're doing well and where your gaps might be. And then we point you towards the tools that will help you plug any gaps so that you have a really tight allergen management system within your centre. And then we've got other tools that just help you manage your day-to-day things. So a record of the food allergies and dietary needs that then needs to get passed on to the kitchen so they know who they're dealing with. So you know who your cooks and chefs are going to be cooking for, a food allergy menu matrix, standardised recipes, and a daily attendance sheet so that you can see who is in the centre on what day and plan your menu modifications according to which children have on that particular day. And then there's tools to be able to communicate at the actual meal times so that you're communicating between the cook and chef and the educators who might be serving that food so they know which meals are for which children, and then some documentation so that it's been formally handed over so we really know that the right meal is getting to the right child. And so throughout the course, we give strategies about how to kind of risk manage different situations. So some of the mistakes that commonly happen in the long daycare setting, and mistakes can happen anywhere in the centre. So it could be in the education space, it could be in the dining room, or it could be in the kitchen. So the most common thing that happens is that the child is given the wrong food. So the food actually contains their food allergen. So we really want to make sure that the handover at meal times happens. So that communication piece is really important between the cook and chef and the educators so that the right meal gets to the right child. And then often a child with cow's milk allergy is actually given the wrong milk. So we're really working hard to get that message out there that if you have a child in your centre who has cow's milk allergy, to check with the parent which milk is suitable for them and to really understand that lactose-free milk and lactose-free formula still contains cow's milk protein, which a child with cow's milk allergy will react to. So some of those errors that are happening are dealt with in this course and in the new modules as well. And then we have all the strategies around cross-contamination. So the most common thing that happens is that a child is given their food allergen. Cross-contamination is really important, but again, let's get the first thing right about making sure that the child isn't actually given their food allergen. And then supervision is really, really important. So children sharing food and accidentally getting exposed to their food allergen. And some of the ways that happens is coming up in a minute. Firstly, with the cook and chef, so, you know, you have a big responsibility, but again, it's everyone's responsibility. So the kitchen is just one place where we need to look after the food allergens, and it's a very important place. But then all those things that happen before the child gets enrolled into the centre and then in that dining space and education space is important as well. So we want cooks and chefs to have those skills to know what's in the food, so to be able to tell which foods have the food allergens and which foods are safe and suitable for children with food allergies, to understand where hidden allergens might be. So foods where you wouldn't necessarily expect to see a particular food allergen, like bread crumbs sometimes will contain, fish or milk or something like that. So just being really aware of where to look for those tricky allergens when they might pop up. What to do with may contain statements, we talk about that. How to know how to prepare food safely, so avoiding cross-contamination, and then that handover of meals process to the educators in the dining space. So some of the situations where children can get accidentally exposed to their food allergen is firstly in the kitchen. So when you're like cooking or pouring liquids, so like milk often splashes out onto other surfaces. Sometimes if you have things too close on the stove, one meal might splash into another one. Spills, obviously if you spill a food, then a child with a food allergy could accidentally come into contact with that, so cleaning spills up really quickly. Some food is just easily spreadable, so supervision is really, really important around making sure that food doesn't kind of inadvertently get into a child with food allergies' food, and that children aren't sharing food. Sometimes spills on the floor can get spread from one room to another as well. And so just making sure that we're really clean and cleaning up messes and spills quickly at meal times is really important. And we know that childcare is a really busy place, and sometimes children will actually pick up the wrong water bottle or drink bottle or drink cup and drink from the wrong cup. So accidents do happen. So that's why supervision is so important. And we know that that's one thing that childcare is really trying to work hard on, getting that supervision around meal times adequate. So what does this new companion course that Ricky's going to talk about in more detail offer? So it's designed as a companion to the All About Allergens course. So if you consider that All About Allergens is the core course or the foundation course for your food allergen management training, and then if you're a cook or chef or have anything to do with preparing food in a long daycare centre, then this course will help you manage specific food allergens in a bit more detail. So it goes into each common allergen and it helps you meet the nutrition needs of those children who have allergies to certain foods. So some foods like cow's milk, egg, wheat are really important growing foods. So they impact a lot on the amount of protein and energy that a child will get. And so we want to make sure that you have enough knowledge and skills to be able to provide adequate nutrition when you're taking those foods out. So we give alternatives. We help you read labels for that specific allergen, and then how to plan and make meals so that you're not having to make completely separate menus for children with food allergy, but you can make little changes to your existing menu and have similar foods for those children with food allergies, so that you take the burden off your workload when you're having lots of children in your centre with food allergies. So there's a number of new videos and animations to help with these learning points as well. So we've developed quite a new suite of resources, which we're quite happy to be sharing with this sector. And then I just wanted to highlight the National Allergy Council's best practice guidelines, which offer guidance and support to childcare services in all states and territories to help you meet the regulatory framework, which includes keeping children with food allergies safe. So there's lots of sample documents and templates, a bit like our food allergy resource hub, but this goes wider than just food allergies and deals with all anaphylaxis and the risk management strategies that you can implement in your service to help you keep children with all kinds of allergies safe, with a big emphasis on food allergies, because that is the most common allergy that you would see in a childcare centre. So that's it from me for now. I'll hand back over to Jodie to introduce Ricky, and she can showcase the new course.
Great. Thank you so much, Ingrid. It was great to hear those statistics on food allergies in children's education and care, and just the importance of planning menus appropriately to ensure that children are receiving safe meals, but also nutritious meals. And it's great to see the foundation course, the All About Allergens training. And I'm excited to hand over to Ricky now to showcase to you how this new course complements the All About Allergens training course to help you with your menu planning. So thanks, Ricky.
Thanks, Jodie, and thanks, Ingrid, for providing all of that really valuable information of food allergen management in early childhood services. So what I'm going to do now is run through the course and some of the resources. The course and modules are available now nationally and are free to access. As Ingrid mentioned, the new course complements the National Allergy Council's All About Allergens for Children's Education and Care online training, and we recommend that you first complete that course before completing the new modules. The new online course is divided into 11 short micro modules that cover different food allergies and how to manage them. The course and modules are designed so that you can pick and choose which modules are relevant to your menu planning needs. They cover different food allergies, food intolerances, celiac disease, guidance on how to manage multiple allergies, and provide you with examples on how to manage these dietary needs. There's also another module that covers other dietary requirements, including kosher, halal, and vegetarian diets. The ideas provided across each of the modules ensures that your menus continue to meet the Victorian government's menu planning guidelines for long day care while also meeting the needs of children with food allergies and other dietary requirements. So if we look at the inside of one of the modules, here you'll see all the things that the module will cover. For example, in this cow's milk allergy module, you'll learn about cow's milk allergy, the nutrients found in cow's milk, and common foods containing cow's milk. You'll also learn the difference between cow's milk allergy and lactose intolerance and some food and meal swap ideas for replacing cow's milk. Throughout each of the modules, there is written content, audio on some of the slides, as well as videos that give visual demonstrations. The modules for each of the allergies and for celiac disease will also show you how to read labels so that you can confidently know which foods are appropriate for children who have that specific allergy. You'll also learn of some examples of how to safely manage food swaps without overlooking nutritional needs. For example, with cow's milk here, you can swap cow's milk for alternative milk such as soy milk, but we also want to make sure that these are calcium fortified. The modules also walk you through how to modify a recipe for children with an allergy. For example, in the cow's milk allergy module, it teaches you how you can modify a recipe by plating up meals and only adding the cow's milk or dairy ingredient like yogurt or grated cheese at the end. This way you can portion out a serving for the child with a cow's milk allergy first, and then you can add the allergen, in this case, a cow's milk ingredient, after you have plated up the food for that child with the allergy. Alternatively, you can use a milk alternative in the same recipe that you are serving to everyone. We know that a centre may need to manage multiple food allergies when planning their menu. The module Practical Management for Multiple Allergens was developed to help you create the one menu to cater for all allergies. The module will walk you through how to prepare food for children with multiple food allergies. It includes making sure that your preparation and cooking spaces are clean, preparing allergy meals with keeping in mind separate space and separate time, putting things in place to make sure that the right food is given to the right child, and give you some other practical tools to manage meal preparation for multiple allergens. The module will also go through some examples of how to change common recipes considering multiple food allergens. This will give you the practical tools to take into your everyday kitchen. At the end of each module, you'll be asked for feedback. After completing the feedback form, you'll be able to download a certificate of completion for each module that you complete. We've also updated a suite of resources that support each of the course modules. These resources provide practical ideas that you can use straight away in your daily work. To make these resources even more accessible, they're also available in multiple languages, including Arabic, simplified and traditional Chinese, Persian, and Vietnamese. Together, the course and resources provide clear, practical strategies to support you in menu planning while ensuring that your menus continue to meet nutrition guidelines. The course and resources are available on the Healthy Eating Advisory Service. Under the Early Childhood Service tab, there is another tab called Allergy and Intolerances. This is where you'll find everything you need to learn about managing food allergies and other dietary requirements in your centre. You can also find the training on the National Allergy Council food allergy training website. Go to choose your course, and that takes you to both the All About Allergens and the new modules. I would now like to introduce you to Vaishali Patel, the Centre Chef from Bloom Early Learning. We're really fortunate to have Vaishali here today to speak to us about her experiences menu planning and managing different dietary requirements. She'll also talk about how she will use the course and resources to assist her with menu planning. So over to you, Vaishali.
Thank you, Vicky. As Vicky said, I work for a Bloom Early Learning Centre, and we have two centres. I work across both the centres, and they go to Melbourne. One centre can take up to 145 children and the other up to 80. Across both sides, we have almost 20 children where we need to cater for multiple food allergies, food tolerance, intolerances, and some of the cultural requirements as well. In my experience working in a long day care setting, the menu planning for the children with their food allergies or a dietary requirement is something that I take very seriously. And it's something that I approach with a great deal of the care and attention and collaboration. It can be difficult to create the balanced menu that caters to the variety of the allergies, especially when multiple allergy or multiple dietary requirements are involved in the same group. The most common ones we see are the gluten-free, soy-free, dairy-free, or egg-free and gluten-free together, or even gluten-free and some intolerances to the milk. Some of the challenges that I go through when catering for the dietary meals for the children is preventing cross-contamination. Although we take all precautions and follow the food safety protocols, cross-contamination can occur easily when catering for the child with a food allergy. Creating a recipe that is safe for all the children with or without the food allergens and without compromising the original tried and tasted recipe can be challenging. And one of the biggest challenges is finding the ingredients that are safe for the children with allergies, and also finding a product that also has the right nutrition for the children. Many product labels includes the warning like may contain traces of the allergens such as soy, wheat, dairy, egg, and seafood or crustaceans even when these aren't the main ingredients. So sometimes I'm not always certain which alternatives to use and which alternative still provides the right nutrition to the children. But with the new online allergy course and resources, I think it's a little bit simpler. I found the new online allergy course and resources very valuable. It provides a clear, detailed information on the range of different dietary needs, including allergies, with a strong and the key focus on a practical guidance to help all cooks, chefs, and kitchen staff, as well as the educators. The course offers helpful substitute options and suggestions, making it easier to cater safely and confidently. I found the modules very structured and easy to follow, making the learning experience informative and accessible. I highly recommend this training to everyone working or wanting to work in a long day care. The course will give a clear understanding of how to safely manage the food allergies and cater for all special dietary requirements for the children's health and the safety at all meal times. It will give confidence to all staff working for children, including the educators and center managers and director, basically everyone in this sector. I think it will give a lot more information. It will make it clear, easy to follow. Thank you.
Thank you so much, Vaishali, for sharing your perspective and talking to just how much care and collaboration goes into managing allergies and other dietary requirements in early childhood settings. Fantastic. Well, thank you so much, everyone, for your questions. Thank you for your attendance today and participation. We hope that you found value in this presentation and that we know for sure that you're going to find value in both the courses and all of the resources that we've developed here. Just a reminder again that the presentation will be sent to you in a follow-up email along with all the links and information that you'll need to access the course and the resources. So thank you again, and that concludes the end of our presentation, and we hope to speak or see you all again soon. Thank you so much.